Thank you so much for joining to the media, and thanks so much for joining Kathy, Emily, and Pooja. What we want to do is really hear from people on the front lines, people who have experienced this pandemic in a really personal way, and hear from you. So this is an opportunity to share your stories, and really your stories are reflective of a lot of people, or what a lot of people are feeling, whether they're in a similar field as you or because they're also going through this as a fellow frontline worker or someone who's been really deeply impacted by the pandemic. So thank you so much for being here. It really means a lot. And I want to start off with Kathy. Kathy, I know you've been really vocal about your experience, and you used a really painful experience in your life as a way to try to help other people so they don't end up going through the same thing. Can you share your story, Kathy, of what particularly long-term care and the pandemic, what that's meant to you and what you've experienced? And if you just hit the unmute.
Oh, I think I'm unmuted now. Okay. Thank you for having me. Yes, I'm part of all the experience all Canadians are having, being locked away from family and friends, having your life changed during the pandemic. But I'm also a part of a smaller group of, over 26,000 who have lost someone during the pandemic, and then an even smaller group, although far too large, of people who have lost a loved one in long-term care. So my father passed away April 15th, 2020, under very tragic circumstances. There was neglect and lack of staffing and just a complete failure in the long-term care system. And it's not even enough to say it's a tragedy, what's happened in long-term care and how broken our system is. And, I spent a lot of time sort of setting aside my grief to advocate and to try and stop it from happening to other people. And I spent a lot of time dealing with things on a provincial level, which is, what long-term care falls under that jurisdiction, and found myself getting nowhere. So I really turned to the federal government to start to implement national standards in long-term care, looking at things like staffing issues, proper pay wages for staff, so that people don't have to work at more than one home. And the larger goal, of course, is to remove profits from long-term care. So I've been working really hard for the last year with a group of people called Canadians for Long-Term Care to try and implement national standards and to work with the federal government to get that done. And the end goal would be no more profits in long-term care.
Kathy, really appreciate your story. Thanks for sharing. And I'm really sorry about what happened to your father, but what you're doing and advocating so that his story doesn't happen ever again is really powerful. And you're helping so many people out by having a way to express what they're feeling, the anxiety, the fear, and really taking this horrible moment where we've seen the inequalities or problems in home care or in long-term care. They've been exposed by COVID-19, but they've always been there. So this is an opportunity for us to fix them. And I really appreciate your call to put people ahead of profits, really is what it comes down to. There should never be this question of profits being more important than the care of our loved ones. So really appreciate that, Kathy. Thank you. I want to talk to Pooja next. Pooja, maybe you could talk about your experience on the front lines. Pooja, for folks, is a frontline healthcare worker, a paramedic, and has been working throughout the pandemic, which is incredibly courageous. And obviously she's on a daily basis, potentially at risk to getting infected and potentially her family, but also what she's seen and what she's experienced, I think is really important for us to know. So Pooja, please tell me a little bit about what you've been going through.
Thank you for having me, Jagmeet. The pandemic has been very different. When I started off on the road last year in May, it was the peak of the pandemic. We were seeing things that we didn't really see when I was a student. I never really had to worry about what I was going to bring home because it was never as big as something like COVID. So as much as I want to be out there helping people and helping my community, it's always scary, and there's always that guilt of what I'm going to bring home and how my family might be affected by it. And I think there's a lot of other frontline workers that probably feel the same way, that maybe have more vulnerable family members at home, and they're afraid of what they can bring home and whether they should be hugging their family and sitting close to them or isolating away from them. And another thing that we see is with changing policy and procedures for hospitals about how many visitors are allowed in the hospitals, we go to these calls, and sometimes we have to tell family members, no, we can't take you with us and we can only take the patient.
Wow.
It's hard for them because I think sometimes they don't know when the next time it's going to be that they'll see their family member again. Sometimes when they're very sick, they don't know if they're going to see them again. And I think that's so tough, and trying to push that message to them that, you know, like, this is for your safety. The hospitals aren't really safe for anyone right now because of everything that's going on. And the most important thing is you can't really take care of your family when they come back home if you're sick yourself.
Right.
But it's heartbreaking to be able to tell that to the family, because they want to be there for their loved ones, and
Of course.
sometimes they just can't because hospitals can't let visitors in. They want to keep their community safe.
Pooja, can you just tell us quickly about the type of how the responses, or the people that you're serving, or that you're going to their homes? Like, who are the people that you're most often seeing, and who are the people that you're responding to in terms of calls that are getting COVID-19?
I think in terms of people that are getting COVID-19, I don't like, COVID-19 can affect anyone regardless of their race or ethnicity. I know there is a lot of communities that are being marginalized, and people are saying that they are causing the spread of COVID, but I don't think that's the case. I think it can affect anyone. As much as COVID might be affecting people, I think the stress, the anxiety around COVID is really affecting people. I think their mental health is really declining. So some of the calls that we're seeing are, I feel like, younger adults or teenagers that are really battling their mental health right now, and their mental health is slowly declining. We're seeing it in adults too. And I think it's tough. Those situations are tough as well, because the hospitals are so like jammed, and, like, you know, they have so many things to take care of, and now in addition to that, they have to advocate for these people who are having these mental health declines. So I think we're seeing the COVID patients. We're seeing, not myself, but I know there's services, and we have set up transfer services so that we can just transfer patients out of Toronto to other hospitals that are able to take on these patients. That's another thing. You're going into this unit where you know everyone has COVID, and then you're putting them onto your stretcher, putting them in your truck, and heading over to a different hospital, right? I think that whole process is very scary too, and
Right.
like, it's amazing that there's people, you know, stepping up to do those transfers as well. It's hard to do that.
Thanks so much, Pooja. I really appreciate that. And now I really appreciate you sharing that, and what it must be like working on the front lines, seeing people that are getting COVID-19, but also people that are dealing, as you mentioned, with the mental health stress of this whole pandemic. It's been really tough on a lot of people. Thank you for sharing that, Pooja. We want to now go to Emily, and Emily is an early childhood educator, and is again on the front lines, and has been probably experiencing a lot of ups and downs with the changing policies and lockdowns and reopenings, and it's been really unpredictable. Maybe you could talk a bit about what it's been like for you on the front lines, Emily.
Thank you, Jagmeet. I've been an early childhood educator for over 20 years in Waterloo, Ontario. It is a joy and privilege to laugh and learn with small children every day. As an essential worker, I am honored to look after the children of other essential workers during these scary times. I worry not only for my own health, but those of the kids in my class whom I care for so deeply, of my coworkers, and as well as the increased risk to my own family as a result of my exposure. Every day I come home from work and throw my soiled clothes straight into the washing machine. My students are unmasked, and I come into contact with bodily fluids that are not my own daily. I have an autoimmune disorder, and I'm worried about my body's ability to fight if I were to contract the virus, so I am especially vigilant with my precautions. But it is more than health reasons that keeps me up at night. As an ECE, I am worried about the financial implications as well. As the primary breadwinner for my teenagers, I have real concerns about continuing to pay the bills and put food on the table. Working in childcare, we are often subject to many illnesses that present with different symptoms. I've had 7 COVID tests since the start of the pandemic. 7 times that I was unable to go to work until my results came back, averaging from 2 to 4 days each time. My university student son, Chris, who strictly follows all public health measures, works in the biggest box store and brought COVID home over the holidays, despite his best efforts. We are so very lucky that his symptoms were minimal and our in-house isolation kept it from spreading to the rest of us. That was 2 more weeks off of work. The last time I had symptoms, the public health rules had changed, and the other 3 working members of my household were also required to isolate. None of them have sick days. This was an incredibly hard hit for my family.
Wow.
I am blessed to work for a high quality not-for-profit center and am fortunate to have some paid sick days, but I know the majority of childcare workers do not. My sick days are used up now as we find ourselves in this dangerous 3rd wave of variants that is affecting children at an alarming rate.
Mm-hmm.
I am actually home today waiting to hear about the first potential positive exposure to my classroom and could very well be facing another 2 weeks at home without pay for me and my family. After weeks of advocating and shouting and screaming, childcare was finally recently granted a priority for vaccination. But it has been less than a week since I've had mine and would not be protected against this possible exposure. It is hard to save money when you work in childcare, but I have a little bit tucked away. That won't go far, however, to cover life expenses if I have more time off this year. I am legitimately worried about losing my house during this time. Life is expensive and inflation is real, yet childcare wages have remained pathetically low for decades. Because childcare is a historically female-dominated industry, it has been neglected and ignored for years. Fees to the families are astronomical. Compensation to employees with a post-secondary diploma and ongoing professional development is depressing. An unchecked hybrid model of for-profit and not-for-profit models means there is a huge range of quality in the level of care provided. It is my hope for my sector that the silver lining during this scary time is that our value to society is fully recognized and sweeping changes are made that would benefit not only children, families, and workers, but society as a whole.
Wow, thank you so much for sharing your experience, Emily, and your experience of having to take time off for tests and having no paid sick leave days left, and your family having no paid sick leave days when they've got to isolate and not able to go to work is the story for so many people. And it is such an impossible choice for people that whether they stay at home when they're sick, not knowing if they're going to be able to pay the bills or going into work sick. These are choices that people have to make that are just so impossible and should not be the way. So I think it's really segues into, I wanted to ask, what do you think one concrete change that would make a difference in your life would be? I kind of have a feeling I know where you're going to go, Emily, with that concrete change, but what is something that you think if we could do one thing better when it comes to workers in this pandemic, you as a frontline worker and your family, what do you think that would be?
2 weeks ago, I would have been shouting absolutely for vaccinations for my sector, but thankfully that has just recently been provided. In the here and now paid sick days, I think for the people of Ontario, my sector, ultimately a universal childcare model. We have been shouting for this for 30, 40 years. It is time it would take care of many of these things.
That's true. That's beautiful. It was like a 3-part one answer. I like that. It was really good. No, it's true though. It's true because the vaccination was key, and you were mentioning that last time we chatted, and that's sorted. But yeah, paid sick leave is going to make a big difference in people's lives. And then, I mean, you can't not talk about childcare and universal childcare. So I appreciate that. Thank you, Kathy. Maybe going to you. What do you think would be the single most, I think I know where you're going to go actually, but the single most important thing, but it's good. Say it. I want you to say it. It's all good. The single most important thing we could do right now.
Yeah, removing profits. And I'm listening to Emily talk about profits in care and childcare.
Yeah, I saw the link too. Good point.
That absolutely. Why are we profiting from care? So removing profits from long-term care and national standards, absolutely, for long-term care as soon as possible.
Beautiful. Thank you, Kathy. Pooja, what do you, in your mind, something we could do that would help yourself or help the people that you are responding to? What would you say one thing that we could do?
I think I mentioned a little bit of it earlier as well, but like I feel like my service has done a pretty good job of supporting us through the mental health strain of the pandemic. But I do feel that we need to bring that mental health support and
Mm,
advocacy out to the public. There's communities that are being marginalized and blamed for the spread of COVID, and these people need mental health support in a language that they understand, not a
right.
language that's foreign to them. We need to be supportive and compassionate because this time is difficult for everyone. And like I said earlier, like COVID and the pandemic can affect anyone regardless of your race or ethnicity. And I think we need to really focus on that.
I really appreciate that. And one of the things that Pooja you mentioned, and I think is worth repeating, is that some of the workers that are getting sick, the frontline workers, are workers that can't work from home, are the ones that have to physically go into work. And those workers are often disproportionately ones that have already been marginalized, the ones that work in factories and warehouses and work in logistics and transportation. They have to go and work in person. And they're the ones that are getting us the goods that we need, the food that we need, the supplies we need. And they end up getting sick, and they're disproportionately, in a lot of cases, racialized. So the blame is not helpful. The support is what is needed. And I really appreciate you highlighting that. Thank you, Pooja. Thank you, all of you. This was really good to be able to chat with you. And I love the integrating in a fix, like something that you'd want to see happen, something that you want to see change in addition to your story. So I really appreciate you giving us a little bit of that. I think that was powerful to hear from all of you. I really appreciate you, and keep on advocating. You are powerful and you've got incredible voices. Please use those voices. And if I can ever help in amplifying them, I'd love to do this again. I'm going to pass it, and just in closing, I just want to say we've heard three really key things that we can do. These are things that we can do right now: making sure we've got paid sick leave that works, making sure we've got a universal, accessible, affordable plan nationally around childcare is vital. Making sure we get rid of profit out of long-term care is so vital. Profit should never come before the care of our loved ones. And mental health is something that has been rising as a major concern. I'm hearing it from a lot of people, and it's not getting enough attention. So providing mental health supports, particularly in the language that communities need it, so that it's more accessible. I think what we've seen in this pandemic is that many opportunities to fix these problems the Liberal government could have done and has failed to. On paid sick leave, there is a federal program we fought for. It's just not good enough. It needs to be improved. We put forward a number of initiatives to say, why don't we get rid of profit out of long-term care, starting with Rivera, which is publicly it's owned by a federal agency. We can make that public instead of having it for profit, and that would make a big difference. That's the second largest provider, and we've been calling for mental health supports to be included in our healthcare system, but so far the Liberals haven't done it. We're going to keep on fighting to make it happen, and I really appreciate all of you. With that, I want to turn it back to Nina and to close off the event.
Thank you very much. Merci beaucoup. Alors, j'aimerais inviter les membres des médias d'utiliser la fonction lever la main pour poser votre question. I would like to invite members of the media to use the raise hand function to ask your question. We will go ahead and start with Chris Reynolds with the Canadian Press. Please go ahead.
Hi, Mr. Singh. Thanks very much for that.
Of course, my pleasure.
We heard some monthly jobs numbers come out today and learned that a lot of people have been without a job for 6 months or more. I see the number was 486,000. And within that number, there are about 312,000 Canadians who have been without a job since at least last April. So I was wondering what basically one or two concrete things that the government needs to do to rectify that situation.
Appreciate the question. One of the things we know is that the pandemic has hit people in a lot of different ways. For some people that can work from home, that have certain jobs that didn't require them going in person, they didn't really feel the impact in terms of employment. But for a lot of people, specifically in sectors that have been hardest hit, anything involving tourism, anything involving the service sector, anything involving festivals and large gatherings, those jobs have not returned. So there are people that are unable to go to work, and their sectors are so hard hit, they have no choice right now. Their jobs are just simply not there. And it's why we've been saying we need to keep providing supports to families who can't go back to work yet. Their jobs are just not available until we beat this pandemic. So continued support for those families, I think, is key. We've been calling for sector-specific support. So those sectors that have been hard hit have to be the ones that we also consider in our supports. And then in the recovery, we have to look at a recovery that centers around people that have been impacted the most. And we know women have been hard hit. So we need to ensure that women are able to get back to work. And that's where Emily's point around universal childcare is so vital. It's probably one of the most important tools to support women to get back into the job force, into the workforce. And we've seen women stretched thin with caring for children, caring for aging seniors, loved ones in their families. And on top of that, not being able to afford childcare has made it even harder for them. And so a lot of women are not choosing, they don't have a choice. They can't go back to work. So that's, I think, another key thing. A recovery that centers around people would be one of the most important ways for us to ensure that the people that you mentioned in the job report that lost their jobs or can't go back to work are supported and are able to get back to work.
Thanks. On another question on the vaccine waiver front. So Canada has committed to participating in the World Trade Organization talks to explore waiving patent protections on vaccines. But I'm wondering, on what side should Canada be arguing? Should we be in favor of this waiver or not, and why?
We should unequivocally be in favor of the waiver, without a doubt. And it's to me disappointing that the Liberals are saying they're open to a conversation. The United States has already committed to the waiver. We unequivocally should be in support of a waiver. What it means is, right now there's patent laws that mean a poor country cannot produce the vaccine because they can't afford to because of the patent protection. And the World Trade Organization is what governs that. And so if this waiver is pushed for, then poorer countries that cannot afford the vaccine will be able to produce those in their own countries. It will literally mean they will be able to save lives. Right now, those countries cannot produce a vaccine and people are dying. Trudeau is going to do a concert to raise money so that poorer countries can actually afford the vaccine. That is ludicrous and absurd when he is not advocating to waive the patent protection so that those countries can actually produce it themselves. Who he's defending in this is the profits of the big pharmaceutical companies, which are some of the richest in the world. They don't need their profits to be defended. Poorer countries that can't afford to produce vaccines, they need help. So to me, the image of Trudeau going to do a concert or supporting a concert to raise money so that poorer countries can afford the vaccine, while not actually supporting the waiver of the patents, which is what the poorer countries need, is the height of liberal hypocrisy.
Thank you.
Thank you very much. Merci beaucoup. Next, I have Bill Curry with the Globe and Mail. Please go ahead.
Hi, Mr. Singh. I wanted to get your thoughts on C10, the Broadcasting Act changes. Your party's position has evolved a little bit as people have expressed some concerns about a recent Liberal amendment. Last night, new amendments came that the Liberals say make it crystal clear this is not about regulating the social media posts of Canadians. There's still some academics who are concerned. Mr. O'Toole is still concerned. What is your view now that the Liberals have announced some changes?
Well, I got to start off by saying the Liberals have just totally mismanaged this. The bill was supposed to be about Canadian broadcasters have a certain set of laws that apply to them. Foreign broadcasters are exempt. That is unfair. Why would we disadvantage local Canadian broadcasters and give an advantage to foreign ones? Like, why would Netflix get an advantage over a local radio broadcast show or local Canadian TV broadcaster? Why would we give that advantage to Netflix over our local Canadian content? That is absurd. That is a bad idea. So to level the playing field makes a lot of sense. But the Liberals have muddied the water, and so we stand unequivocally in favor of freedom of expression. People should be able to raise what they want on social media, be able to critique the government if they want, be able to produce the content they want to produce. So to make sure this is abundantly clear, we've been calling for an independent constitutional or charter analysis to make sure that this is not going to impact people's freedom of expression. We're only here because the Liberals have so poorly managed this, which should have been an easy thing to do. We just want to level the playing field. That's an important, strong thing to do. But they've been so unclear and have done such a poor job of this that we're at this point. I'm hoping, though, that an independent analysis based on the charter will address any concerns if they still remain.
And just as a follow-up, specifically on these amendments that the Liberals are announcing last night and this morning, does that fix the issue? Have you had a look at them? What do you make of them?
Well, the problem is that it's still raising some contradictory concerns by experts. We're hearing different opinions. Some are saying that this does fix it, and some are saying it doesn't. So that doesn't solve the problem. We want to make sure that there is full confidence that people can express themselves on social media. They can use the tools that exist to share their thoughts and ideas without any problem. It's something that I use. I mean, y'all know that I'm very, very avidly engaged on social media, and I use it regularly. So I get that people want to be able to continue to use it in a way that is not encumbered or not limited by free speech issues from the government. So I get that. And that's why I think we still have to go to a charter analysis to let any concerns that still may be present be addressed and ensure that we are actually moving forward in a way that protects freedom of expression.
Thank you very much. Merci beaucoup. Prochainement, j'ai Geneviève Normand avec Radio-Canada. C'est à vous.
Oui, bonjour. Merci de prendre ma question, M. Singh.
Bonjour.
Bon vendredi. Cet après-midi, la chef de cabinet du premier ministre va témoigner et je serais curieuse de savoir, M. Singh, si vous pensez que c'est vrai que Katie Telford n'a pas parlé des allégations visant le chef d'état-major Jonathan Vance au premier ministre Justin Trudeau. Pensez-vous que c'est vrai?
Merci pour la question. Je pense que le premier ministre savait les allégations. Je pense qu'il l'a su. Mais pour moi, ce qui est plus important, c'est quoi les actions maintenant? Qu'est-ce que le Premier ministre va faire maintenant? Parce que jusqu'à ce moment, la réponse du Premier ministre était de lancer une autre enquête. Et c'est fou parce qu'on a une enquête de 2015 faite par Justice Deschamps, aussi une justice de Cour suprême du Canada. Et elle a écrit clairement qu'on a besoin d'un processus indépendant dans les forces canadiennes pour déposer des plaintes. Et 600, le gouvernement libéral, Justin Trudeau, était au pouvoir pour 600 et il n'a pas agi pour mettre en œuvre cette recommandation. Donc, pour moi, le problème, c'est effectivement, on a un premier ministre qui dit les belles paroles, qui dit qu'il s'inquiète des enjeux qui touchent les femmes, mais il n'a pas agi, il n'a pas pris des actions, il n'a pas pris des actions concrètes pour régler le problème. Et ça continue. Donc, ça, c'est pourquoi peut-être que vous pouvez voir dans ma voix que je suis un peu fâché parce que c'est complètement inacceptable que les femmes, à ce moment, ont un message qu'ils ne sont pas écoutés, ils ne sont pas sécuritaires. Ils peuvent soulever une plainte, ils peuvent déposer une plainte, et cette plainte peut arriver au bureau du Premier ministre et rien n'est fait. Ça, c'est complètement inacceptable. Et ça, c'est pourquoi je pense que c'est la responsabilité de Justin Trudeau de régler ça en mettant en œuvre la recommandation de le rapport Deschamps de 2015.
Et qu'est-ce que vous dites au fait que, par exemple, on utilise l'argument en disant qu'on n'était pas au courant que l'allégation était de nature sexuelle? Ça, c'est l'argument du PMO de Mme Telford. Est-ce que vous achetez ça comme argument? Est-ce que vous pensez que quand les discussions montent à ce niveau-là, est-ce que vous... Encore une fois.
Non, je n'accepte pas cette argumentation, cette excuse, parce que c'est une excuse. Le gouvernement libéral savait le problème. Le Premier ministre savait aussi. Tout le monde savait. Et la réalité, c'est, malgré le fait qu'ils ont su le problème, ils n'ont pas agi. Ça, c'est la réalité. Et ce qui est pire, encore pire, c'est le fait que c'est exactement la même situation en 2015 et on a eu un rapport qui montre exactement, il y a une culture qui est dangereuse pour les femmes dans les forces canadiennes. Les mots de Justice Deschamps, une culture qui est, en anglais, elle a dit hostile envers les femmes. Donc, cette culture existe et il faut les régler. Elle a dit aussi que ce n'est pas suffisant de seulement répéter le mantra tolérance zéro. Elle a dit clairement que ce n'est pas suffisant de dire ça sans agir. Donc, elle était claire qu'une recommandation, la recommandation clé, c'était mettre en œuvre un processus indépendant dans les forces canadiennes pour déposer les plaintes. Et j'ai aucune explication pourquoi le Premier ministre n'a pas agi, n'a pas fait ça, parce que c'était clair c'était écrit clair, c'était 600 et il n'a pas agi. Donc, pour moi, c'est complètement inacceptable la situation. Il savait que c'était des inconduites sexuelles et il faut agir, mais ils n'ont pas agi.
Merci beaucoup. Thank you very much. Just going to do a last check. If there are any more questions, to please use the raise hand function. S'il y a d'autres questions, veuillez utiliser la fonction lever la main. I see no more questions. Je ne vois plus de questions. Donc, ceci met fin à notre conférence de presse. This concludes our press conference.
Thanks so much. Again, big shout outs to Kathy, Emily, and Pooja. Thank you so much for being here. Thanks for the questions and thanks for organizing all this. Thank you. Take care.